A child's smile is one of life's greatest blessings. A child's smile makes us smile. It makes us laugh. It has no language or racial barriers. It happens in a flash, but its memory lasts a lifetime. One of the greatest threats to a child's smile is tooth decay. Despite technological advances in dentistry, tooth decay remains one of the greatest unmet needs in healthcare, not only in Utah, but across the entire United States. Sealants for Smiles provides oral health services to Title I and low-income elementary schools. Sealants for Smiles' mission is to provide oral health education and dental sealants to those children who would otherwise not have access to those services.
It's important to me to have good teeth because I don't want to have to get dentures or have crappy teeth.
It's important to take care of my teeth because so I can eat.
Because you're gonna keep them forever like that when you grow up.
You can't eat anything if you lose all your permanent teeth.
Because once you lose your baby tooth, you're gonna have your teeth for the rest of your life.
Get your baby teeth and then you get your permanent teeth, and they're not really permanent if you lose them.
Sealants for Smiles is a school-based oral health program, and we specifically provide oral health education and dental sealants to those children that can't afford it or have no access in any other way.
Sealants for Smiles is a great program that is helping the underserved children in our community. And our relationship with them is that we get to provide all the sealant material that they use for their programs.
The Centers for Disease Control recommends strongly that school-based dental sealant programs are effective in treating dental decay.
Sealants have actually shown also through the Surgeon General's report to prevent dental decay up to 70%. It's because this clear plastic is placed on the chewing surfaces of the teeth where 90% of the decay actually begins with school-age children.
Almost 50% of the children, not only in Utah, but across the entire United States, have unmet dental needs. It's staggering.
Dental decay is the most common chronic childhood disease, and because of such, is very important to the well-being of the child.
The early years are the most critical for learning. Kids need to be at school as often as possible. They need to be there 100%, feeling good, able to focus on what they're to be learning when they're at school. When we have our kindergartners, our first graders whose mouths are hurting, again, they're missing such a crucial foundation for success later on in school.
We do have kids in our school that have never been to a dentist. We had a couple of students this year specifically that it became an issue where there was some major things that were happening and they were complaining a lot of problems in the mouth.
Their mouths can be hurting so badly that they can't eat well, they can't sleep well. Then they come to school and try to learn, and as one might expect, it's pretty impossible to concentrate on the tasks at hand.
To learn, you have to have your basic needs met. You need to be fed, you need to have your clothing, and if you're in pain, you're not concentrating.
When a student comes to school facing those challenges, their chances of success are diminished.
Oral health is such an incredibly important part of overall health, and many times is overlooked, and yet we shouldn't consider it as just an optional. If we have time or money, we'll cover it, but it really does affect the overall well-being of that child.
A cavity is something that eats stuff in your tooth and it makes holes in your teeth.
A cavity is like bacteria that's on your tooth that makes that tooth hurt.
Well, then they'll get all decayed and gross and black and brown and stuff, and they'll start to rot, and then they'll fall out and you'll have to get dentures.
One of the surprising things about this is these are not necessarily poor people or people who won't work or don't have jobs. Most of the people that we deal with are people with jobs that perhaps are not at the level where they get benefits, dental health insurance in particular, but these are people, good, hardworking people who just need a little assistance to get this taken care of.
Typically, the parents were, number one, aware of that their kids had significant problems, and number two, however, they felt hopeless because they didn't have the means to provide it.
One of the most difficult barriers is paying for dental services because it is so costly.
Many parents recognize the importance of dental health but simply don't have the means to adequately provide for their kids.
Many children, in fact, in the state of Utah who have been identified as having urgent dental health needs or decay that has reached the point where it's causing pain or other problems that need that care, but they're unable to get the care because of cost barriers.
I think it's easy for people to look in and feel like if there's families that aren't getting in there and kids who have these problems that maybe the parents aren't interested in taking care of this. And yet the parents have been so grateful and so excited about the program.
Many working people don't have good dental health insurance policies.
It's not a matter of parents not caring, it's simply a matter of parents not having the wherewithal at this given point in time to take care of their kids' teeth.
Another barrier that we have is that my husband takes the car to work all day and I cannot take them.
There's, unfortunately, for many of our kids, they're the ones who bear the brunt of this, but they're the ones who lose because of their parents' inability to access services.
Having Sealants going to the schools, the Sealants for Smiles going to the schools, allows these children to receive care where they, in more likelihood, would not receive that care.
I'm here to get sealants on my permanent molars.
Because they put clear coating and it's like a barrier from like all the bacteria that decays your tooth.
Sealants are a preventative treatment for permanent teeth. A sealant is a plastic material that usually is applied to the chewing surfaces of the back molars.
Today I'm getting sealants. And they're going to put this weird tasting stuff on my mouth so that it will prevent cavities and so I don't have to get fillings.
The presenters went through the process of instructing students how to properly brush their teeth, how long it takes to adequately brush your teeth, what kinds of strokes to use. So it was a learning experience as well as an information experience about the whole program.
I think education is probably the biggest factor when you have kids in a chair, and especially in a school program, because I think so many of them aren't educated that if you get that opportunity, it can last a lifetime.
They were even given dental hygiene kits of toothpaste and toothbrushes that they could take home with them, as well as being instructed about what a sealant was and what purpose it served, and what a great thing it is for the students to access this and their families to allow them to access it, because it would help their overall dental hygiene through their youth.
Well, you have to brush it everywhere in your teeth.
First, like this.
And you brush on the outside.
And then you go sideways.
Your front teeth, and
then you can brush it like in there, and then you can brush it for a few minutes.
Your back teeth, and
then you can go on the other side and go that way.
Your other back teeth.
You brush it on top, and then this side here, and then that way.
On top of here, in your cheeks, inside.
I brush it there.
Brush it in little circles all around, and you need to do it on your gums.
You can start doing the other side.
And your tongue.
Then you can rinse your mouth with water, and then you can spit it out.
So it gave the kids a chance to have a really engaging, fun, safe experience with a dentist, which I know there's a lot of dental fear for adults and kids. So for them to be able to see that in a fun, exciting way, in a way that wasn't painful, where they felt good and the hygienists were really good with the kids, it was really a great experience.
Dental needs are just as important as other medical needs. They tie together. And so I really appreciate the service and what they do for our students.
By bringing the Sealant for Smiles program to them allows an opportunity for those children to get the care that they normally wouldn't have gotten.
The people associated with Sealants for Smiles make it so easy to provide this service for our students. They are very well organized. They helped me be organized. They helped us get set up. They worked with us so well, and I would advise any school who has the opportunity to take advantage of the opportunity for their kids.